Start by checking to see if Amanda's ready to receive an upper cervical treatment today. Where the brainstem is sending too much blood, and we never do any twisting or popping of the neck adjustments. So this table is popped up about 1/4 of an inch. We're going to apply just the right amount of force till the table drops back down. To make sure that we're getting the change that we're looking for and that the patient's getting better over time. We adjusted the left side of her C1. We were able to bring absolute balance to the entire part of her neck without ever touching these lower bones down here. Hi everyone, my name is Dr. Christina Koblish, owner of Upper Cervical Chiropractic of Boulder. So today we have Amanda here. She sought us out because she was having some really chronic neck pain. She wasn't moving very well. It was challenging for her to sleep, and overall, she was only 22 years old and felt, my neck should not feel this bad. We did highly specific imaging to see exactly what's going on with her neck, and I was able to gather exactly what we needed to do down to the exact millimeter how to correct what she was experiencing with her neck pain. So the way that we assess, does someone need to be adjusted today or not, is through this scanner right here. We do this with every single visit before and after each treatment. Okay, so here's what we have going on in Amanda's scan here today. What we're looking for ultimately is we want to create symmetry and balance in her neck. So this was a reading all the way down, starting from her C1 to her C7. And we can see that in this upper part of her neck here, she actually has pretty good balance, but it's the lower part down in her shoulders, particularly on the right, where the brainstem is sending too much blood and the energy is not equalizing from side to side. And ultimately, by just adjusting this one bone in the top of her neck, we can have a global change throughout her entire spine. So, you ready to get adjusted? Okay. So the way that an upper cervical adjustment is done is very different than your traditional chiropractic adjustment. Amanda, we never do any twisting or popping of the neck adjustments in order to correct the upper cervical spine. Is we're actually going to be adjusting the left side of her atlas, which is her C1 right here. So through the specific imaging that we took of her, we learned that this bone is not seated all the way onto the bone underneath it the way that it should. The way that we adjust the bone is very quick, it's very light, and like I said, we do it all in a neutral position. So I'm just going to set this headpiece right here to the weight of Amanda's head. And she can tell you this is a very light adjustment. It's not scary at all to receive, especially if you're someone who doesn't truly like your neck being adjusted. This is really great for folks like that. Go ahead and lean towards me just a little bit here. Good. And relax the shoulder down. Perfect. So this table is popped up about 1/4 of an inch. We're going to apply just the right amount of force till the table drops back down. We're going to give Amanda just a couple of seconds to let her body integrate and rest that adjustment. And this is the most important part of what we do here in the upper cervical practice, is we have you rest for 15 minutes afterwards. So go ahead and nice and easy sit up for me, Amanda. Okay, I'll have you walk to the resting area. Okay, so go ahead and scoot back all the way. Another big part of what we do here is we put this pillow behind her neck, and it's going to create a little bit of extra traction as she's laying here, which will just help open up the joint spaces, allow for more blood flow, and honestly, they're quite comfortable, so I know she's a fan of them. She's going to enjoy 15 minutes, and we will bring her back in, scan her, and see how she did. Okay, so we just got Amanda up from her 15-minute rest after her upper cervical correction. Now we're going to do a post scan to make sure that we made positive change that we were intending to make with this adjustment. This scanner helps keep me accountable every single time a patient comes in to make sure that we're getting the change that we're looking for and that the patient's getting better over time. This is also the same tool that I use to determine if someone's holding their adjustment. So let's see how Amanda did. Okay, so just to review, here's her before scan that we had. We had most of the imbalance and the pain happening for her in this lower right-hand side of her neck. After we adjusted her, and as a reminder, we adjusted the left side of her C1. We were able to bring absolute balance to the entire part of her neck without ever touching these lower bones down here. So if you or anyone you know suffers from chronic neck pain or headaches or any kind of pain in your upper body or neck, and in particular if you are not a fan of getting your neck adjusted, this is an incredibly gentle and precise technique that allows us to make amazing change with just one simple adjustment. Again, my name is Dr. Christina Koblish. Thank you so much for watching these videos, and if you have any questions, I want you to just click that message below, send us a message, tell us what's going on. I would love to talk to you and see how upper cervical can change your life. I love and appreciate you. Thanks so much, and I'll see you in the next video.